Prolonged grief disorder is characterized by difficulties in engaging in social or enjoyable activities, a reduced ability to experience positive mood, and difficulties accepting the death of a loved one. A duration criterion of 6 months was proposed to ensure that natural grief reactions in the acute state following the bereavement are not confounded with the syndrome of PGD. So to give you some background on past research on grief, past studies have been conducted to validate prolonged grief disorder. One notable study in prolonged grief disorder assessed grief on the following variables: physical functioning, social functioning, role limitations due to emotional problems, mental health, pain, energy, and general health perception. It showed that the construct of prolonged grief disorder is needed to identify a subgroup of mourners at risk for quality of life and mental health impairment. This study was conducted by Bolin and Prigerson in 2007. Another study looked at the variability of grief and normal grief in evaluation of grief response. They also looked at categories of the grieving process. Some of these categories are expression, coping, time, making sense, recovery, and circumstances influencing bereavement. Participants in the study acknowledged the negative impact of placing set expectations about the process of grief on the individual who is mourning. They also perceived certain grief responses to be more appropriate than others to the bereavement experience. This study was done by Costa et al. In 2007. So our hypothesis for this study was that as the prevalence of prolonged grief disorder increases, the prevalence of depression will increase as well. We had 239 virtual survey respondents. 180 of those were female and 59 were male. Respondents were required to be age 18 and could be as old as 90 years old. We had a great variability in age differences. In order to participate in this study, you were required to have experienced a loss of a loved one. The loss should have occurred at least 6 months, so that it's not in the acute stage, and no more than 10 years should have passed since you lost your loved one. Our survey was sent out via email, and the questions were based off of the General Anxiety Disorder 7-item scale, the International Prolonged Grief Disorder Scale, the International Trauma Questionnaire, the Prolonged Grief 13-item questionnaire, Patient Health Questionnaire, and Somatic Symptom Scale. Some of the examples of the questions being asked are: in the past month, how often have you felt yourself longing or yearning for the person you lost? And do you feel that life is unfulfilling, empty, or meaningless since your loss? Our survey was created by the University of Arizona. In order to continue with the survey, our participants had to give consent. The survey contained 52 items ranked on a Likert scale. Survey answers were coded using the Magic Measures demographic based on the 6 surveys used in our overall survey. The correlation was not significant, indicating that there was no relationship between depression and prolonged grief. On the right side of your screen, you'll see a graph which indicates the depression scale along with the International Prolonged Grief Disorder Scale. As you can see, these numbers are very out there and are not in one linear line. Our hypothesis was not supported. The Pearson-R correlation showed that there is no statistical significance in the relationship of prolonged grief disorder and depression. Our sample included individuals originating from 23 different countries. The study that it was being conducted by the University of Arizona is a cross-cultural study. And so having individuals from 23 different countries supported their cross-cultural aspect of their study. This variance allows for a wider understanding of how different cultures across the world grieve and process a loss. There were several limitations that may have caused the data to be non-significant in its findings. The survey was sent out in the beginning of the COVID-19 lockdowns in the US. A lot of people were working from home and therefore might be in a different environment. They might be more isolated. They may be happier because they're at home. They're not dealing with the typical workday stressors. There was also a hyper focus placed on death from COVID-19 when the survey was sent out. And so this might have elevated individuals' feelings of grief and loss and bereavement during this time, as they were constantly seeing more and more death on their TV screens. And as mentioned before, working or learning remotely, people may have felt more isolated and therefore more depressed or feeling their grief more so. For possible research in the future, I think it would be really interesting to look at grief in terms of the bereaved individual's relationship to the deceased at the time of their death, say if they were close to the person or if they had been at a distance with the person for a substantial amount of time. It'd be interesting to discuss the question of whether or not a person's closeness to the deceased makes it easier or harder to accept the loss. Thank you so much for watching, and if you have any questions, please feel free to reach out.